Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to take a few minutes to discuss with you the difference between normal and abnormal rhythms of the heart. This is a normal heart which has two top chambers called the left atrium and the right atrium, and two bottom chambers called the left ventricle and the right ventricle. The top two chambers are priming pumps for the bottom two chambers. The left ventricle pumps oxygen-rich blood to the body, which uses this oxygen to perform work. The low oxygen blood returns to the right side of the heart, where it is pumped through the lungs and oxygen is picked up. This oxygen-rich blood returns to the left side of the heart and is pumped out to the body where the oxygen is used. The top two chambers of the heart are electrically separated from the bottom two chambers of the heart throughout the entire heart except for this small area here called the AV node. Normal activity in the heart starts in the pacemaker of the heart called the sinoatrial node, or SA node for short. The SA node is located in the upper portion of the right atrium of the heart. Once the SA node starts an electrical impulse, it rapidly spreads throughout the top two chambers of the heart, causing them to contract and force blood into the bottom two chambers of the heart. The electrical activity from the top chambers of the heart comes together at the AV node, where it is slowed down considerably to allow the top two chambers adequate time to pump the blood into the bottom two chambers. Once the electrical impulse passes through the AV node, it accelerates rapidly down two very special electrical tracts called the left and right bundles. This electrical activity stimulates the bottom two chambers to contract, forcing blood out of the heart into the lungs and to the body. Once the bottom two chambers have squeezed the blood out, the heart relaxes and fills with blood that has returned to the heart from the lungs and body. When the heart is filled with blood, the entire process is repeated when the SA node or pacemaker starts another electrical impulse. We call any disturbance in the normal activity of the heart a dysrhythmia. The two major classes of dysrhythmias are problems in the top part of the heart and problems in the bottom part of the heart. The four most common types of problems in the upper part of the heart are called premature atrial contractions, or PACs, atrial fibrillation, atrial flutter, and paroxysmal atrial tachycardia, or PAT for short. When atrial fibrillation is present, the normal coordinated contraction of the top two chambers is lost. The muscles of the atria wiggle much like worms on the ground. As a result of this, the proper emptying of blood from the top two chambers into the bottom two chambers does not occur, and the efficiency of the heart is markedly reduced. In addition, when atrial fibrillation develops, the heart rate increases very much and becomes very irregular. PACs are caused by the firing of a second pacemaker in the top part of the heart. As a result, an early beat occurs. If a lot of these occur, the pulse can be very irregular. Atrial flutter is a dysrhythmia which is caused by the formation of a short circuit within the electrical system of the top two chambers of the heart. When atrial flutter occurs, electrical activity runs around the top part of the heart in a circular pattern, much like a tornado. When the atria are stimulated to contract in atrial flutter, the atria contract very quickly, almost 300 times per minute. The force of contraction with atrial flutter is much weaker than with normal beats. As a result, the proper emptying of blood from the top two chambers into the bottom two chambers does not occur, and like in atrial fibrillation, the efficiency of the heart is markedly reduced. Furthermore, the heart rate is often increased with atrial flutter, typically above 150, but unlike atrial fibrillation, the heart rate is usually regular in atrial flutter. PAT is a dysrhythmia which is caused by the formation of a short circuit between the electrical system of the top part of the heart and the electrical system of the bottom part of the heart. A circular pattern of electrical activity occurs in PAT as shown here. As a result, heart rates can be very fast with PAT, even as high as 230, and almost always the heart rate is regular. There are three basic types of dysrhythmias in the bottom part of the heart. PVCs are premature ventricular contractions, ventricular tachycardia, and ventricular fibrillation. A PVC is an early beat which comes from an abnormal pacemaker in the bottom part of the heart. PVCs by themselves are not dangerous, although they can be very irritating since the irregular heartbeat they produce causes palpitations and unusual sensations in the chest which are not painful. Occasionally people with lots of PVCs have heart problems, but when the heart is normal, PVCs do not reduce the length of life. Ventricular tachycardia is caused by a short circuit in the bottom part of the heart which results in a very rapid heart rate. The heart rates are sometimes so fast in ventricular tachycardia that the heart cannot effectively pump blood to the body and to itself. For this reason, ventricular tachycardia can degenerate very quickly into ventricular fibrillation. When the bottom part of the heart fibrillates, it wiggles in much the same manner as in atrial fibrillation. When this occurs, effective blood pumping is totally lost and no blood gets pumped to the body. Death proceeds within seconds. All of these electrical rhythm problems come from abnormal pacemakers, short circuits in various parts of the heart, or fibrillation. All medications used to treat these rhythm problems either block these short circuits, slow the heart rate, or prevent fibrillation.